Welcome to Maine Public News Connect, original news stories from Maine Public Radio, airing weekly in Spanish, French, Portuguese, Somali, and English. I'm your host, Ari Snider. Today is Friday, December 20th, and here are the week's top stories. Medical interpreters and dozens of supporters rallied outside Maine Medical Center in Portland last week, calling on Maine Health Management to meet their demands for a proposed labor contract. The interpreters voted last year to form a union. French and Lingala interpreter Alex Bukasa said wages are a key issue, but he said he's also concerned about the health system's reliance on interpreters who are brought in over the phone. As an in-person interpreter, Bukasa said he often has to help bridge cultural as well as linguistic gaps. In a statement, a spokesperson for Maine Health said it is, quote, confident the parties can reach a fair and responsible agreement. Women in Maine face continued barriers to economic equality, according to a new state report. Women are more likely than men to be employed part-time and more likely to say the reason for working part-time is a childcare problem or family obligation. There is also a persistent gender wage gap, with women earning on average $10,000 less than men. The report says one way to address this inequality is to bolster the state's childcare workforce so that fewer women are forced to put their careers on pause in order to take care of their kids. President Joe Biden this week designated a new national monument in Newcastle, Maine, honoring Frances Perkins, who was the country's first woman to serve in the presidential cabinet. Perkins was a key force behind some of the nation's most sweeping labor laws and reforms. During her 12 years as labor secretary in the 1930s and 40s, Perkins played a key role in bringing about the New Deal reforms that helped the country emerge from the Great Depression. Those reforms included standardizing the 40-hour work week, establishing Social Security, and implementing a federal minimum wage. The Perkins Home is the second national monument in Maine. National monuments are managed by the National Park Service and are intended to protect sites of historic, cultural, or scientific importance. Harvard Pilgrim, a large health insurance company, has agreed to continue insurance coverage in Maine for 2 HIV medications. The insurance company had planned to drop coverage for the drugs in some of its 2025 plans. Several physicians and advocates filed a discrimination complaint, which prompted an investigation by Maine regulators. This has been Maine Public News Connect. We'll see you next time. Thank you to our excellent community partners for supporting and contributing to this program. Maine Public News Connect is made possible by individual supporters and foundations from across Maine, as well as cPort Credit Union, Hannaford Supermarkets, IDEXX, MaineHousing, Coastal Enterprises, CoverMe.gov, the Sam L. Cohen Foundation, Koo and Patricia Yuen, and Maine Health Access Foundation. Maine Public News Connect is made possible by Koo and Patricia Yuen, committed to bridging cultural differences in our communities.
cPort Credit Union, providing innovative banking solutions while actively supporting Maine's diverse communities. cPortCU.org.
Hannaford Supermarkets, celebrating the diversity of its employees, customers, and communities, and committed to fostering a welcoming environment. Together, they're greater than groceries. Learn more at hannaford.com. At MaineHousing, they know that an affordable home is key. The First Generation program gives Mainers the chance to be the first in their family to own a home. Home ownership is possible. Learn more at MaineHousing.org.
You can compare plans and get financial help to lower your cost at CoverMe.gov, a resource for finding health insurance that fits at a price that works.